I see this guy, I don't know, a couple times a week, maybe once a week.
Something like that.
We're getting some teeth and gum work done. He's done a fantastic job. He's my dentist. He's our family's dentist. And, of course, he's here to talk about the issue of sleep apnea. Dr. James Sanderson joins us in the studio. Good morning, brother. How are you?
Good morning. Thank you for the opportunity to come and visit about this.
Man, thank you so much for coming in. It was something that came to my attention, I guess, about maybe 8-9 years ago when I'd be taking a nap and someone would say, dude, you stop breathing for about 2 minutes. And I was getting kind of worried. And then I realized I was doing it on the show awake.
Yeah.
And I didn't realize that sleep apnea, I guess it doesn't have to be sleep apnea, but I'd be sitting there on the air and all of a sudden, and I'd do it on the air. And
people driving down the road, and falling asleep for a little while. And some of the major wrecks that we have is people are just sleepy.
Yeah, I mean, when you want to sleep, you're going to sleep. I mean, regardless
and you can't
of where
stop
you're at. Talk about exactly what creates sleep apnea. I think a lot of people out there think that being extremely overweight, having bad dietary habits, and that certainly can lend itself to worse sleep apnea. But skinny people like myself get it too.
Yeah, I mean, when I found out that I had sleep apnea, I had just lost about 40 pounds. I'm at 180, and that's got nothing to do with it. But what causes sleep apnea is when your tongue falls back to the back of your throat and just closes off your airway.
And what makes that do that? I mean, what causes
you relax. And just gravity, and just as everything starts to relax, and your tongue just starts going further and further back. People think that, we're snoring, that's the bad thing. Well, while you're snoring, you're actually still safe. You're just making noise.
Is there a direct correlation between people who snore and have sleep apnea, and vice versa?
That doesn't necessarily mean you have sleep apnea, but it's a really good chance that you do.
All right, so I know there's the CPAPs out there, and I got a friend of mine, he doesn't fly without it, and it's a pain in the you-know-what. It's huge, and it makes all kinds of noise, and sometimes he forgets to wear it. But you got this great solution. It's something you can hold in the palm of your hand. I've got mine down in the car. I was going to bring it in and take a picture this morning. It's a great appliance. Tell people about it.
Well, it's a sleep appliance. It's a mouthpiece. It goes on your bottom teeth and your top teeth, and it holds your bottom jaw forward. And by doing that, it keeps your tongue from falling back in the back of your throat. The question is, how far forward do you need to have it? And what we found is by being able to do sleep tests in people's beds, we follow up and see whether or not what we've done has worked. And the advent of the sleep appliance, along with doing a sleep study in their bed, that's made that a safe thing for a dentist to do. But I still have to work with physicians no matter what I'm doing.
And Tony and I both came in. I went in first, and in the consultation with you kind of described the research that you did on this product. It wasn't like you just kind of jumped into it. Explain how extensive a research effort you had and why you know this works.
Well, I've done sleep appliances all my practice life from time to time, but I didn't have a way to follow it up. And so if I'd make one, I'd give it to somebody, and they were expensive, and because the lab fees were so high, and you'd give it, and they were big appliances and this kind of stuff, and most of them were uncomfortable appliances, and you pat somebody on the back and say, okay, let me know how it does, but I didn't really know, whether what I did worked or not, outside of what the patient said. But having the ability to do a real sleep study to find out what's going on and then communicating that back and forth with the physicians, that makes a world of difference.
Dr. James Sanderson, you can give me a call at 979-6005 at sleepdentistbirmingham.com is the website. We do a free giveaway of a sleep study every single week, and I think that's one of the things, because I've been saying for 3 or 4 years, telling my wife, I'll go get a sleep study. We obviously got kids. I didn't want to spend a night somewhere in some strange bed with a bunch of wires on me and people staring and gawking at me like a fish through a window. And in your particular case, put your finger in a little hole, put a couple tabs on your chest, and you fall asleep. You fall asleep right there in your own bed, man. And I mean, I'm sleeping like a baby, and I didn't realize it was on. And then by the time I got to your office, you already had all the data. Shut up, Al.
That's right. Well, I mean, and it's true. And I didn't think I had sleep apnea, and we've tested people that I thought probably for sure had sleep apnea, and they didn't have sleep apnea. So it's really It's an interesting thing.
All right, so not to be morbid, but how do people die? How do you see a 37-year-old man die of sleep apnea when he never had any type of health issues in the past? And why doesn't his body involuntarily pick up his breath when it knows it needs oxygen?
Well, you sit there and you close your airway off, so your brain's not getting any oxygen, and the brain starts telling the heart to pump faster, and sometimes people will have a stroke or different kind of things. I had one gentleman who was a patient of ours that we sedated in the office. And when we were doing the procedure, and his blood pressure went to 250 over 150.
Wow.
And I told him the next day, I said, I brought him in the next day because you can't talk to somebody when they're sedated. And we came in the next day, and we talked about it and said, hey, look, this is, we need to get some treatment done here. Excuse me. And he said, okay, he said, your machine's wrong. My blood pressure, let's take my blood pressure now, my blood pressure's fine. And I was like, no, it's not wrong. This is real. And so he finally said, okay, well, I'm going to my physician in a couple of weeks, and I'll take this stuff to him. And I was trying to get him to go to the sleep physician that day. And before he got to his physician, he had a major stroke, and his life will never be the same.
Wow. And, it's funny because snoring's always been kind of funny. My mom snored, my dad snored, and we used to make fun of each other. And we always talk about freight trains coming through the house. My dad was my mom snored louder than anyone I'd ever heard. And we laugh about it, and it was kind of cute. It's kind of funny. But as you're married, you got kids, it's the point where my wife's got to go to bed before I do in order to fall asleep, because if I go to bed before she does, she can't fall asleep to me snoring. And it got to the point where I was hurting her. So it's not only hurting yourself with the sleep apnea situation, the snoring, period, but it's also hurting your mate. And I'm telling you, when I wake up in the morning with my sleep appliance in my mouth, I wake up in the morning and I see her lying next to me, I know it's working, because she didn't have to get up and go to one of my kids' beds to sleep and get away from my loud ass. You know what I mean?
Yeah. I mean, in families, if somebody in the family's got sleep apnea, you better look around.
Yeah. Your office
and
is
Reggie
right
White made this pretty much a big deal back when he passed away, because that's what he suffered from, right? Yeah.
and just didn't really, we haven't paid attention to it. And football players are great candidates. Mm-hmm. And we've treated several football players, a couple of Auburn guys that we've treated. And some of them we've ended up having to do dual therapy, the CPAP as well as the mouthpiece, because the CPAP they weren't able to sleep with the CPAP. But by bringing their jaw forward, they could turn the CPAP down enough where they're doing great now. And it's just awesome. It's phenomenal.
You do fantastic work. 979-6005. Give them a call. Dr. James Sanderson, sleepdentistbirmingham.com is the website. You can continue to go to joxfm.com, their contest tab, to win a sleep study throughout the years and throughout the weeks, and we really appreciate you coming this morning. You're a life changer for me. And on the commercial, we have restaurants and different things that we sell off here that we love our clients. But when you could do a life changing endorsement for something like this, something that's serious, it's something that needs to be done as soon as possible, and it's a great thing, and you're doing a great job.
Possible life saving.
Yeah.
I mean, it's changed my life. I mean, I thought every 57-year-old guy felt like crap.
Could you imagine getting to the day and not needing a nap? That'd be pretty nice. Thank you, Doc. Appreciate you.
Thank you.
There he is. Dr. James Sanderson, sleepdentistbirmingham.com, 979-6005. I got a dentist appointment for a cleaning.
Oh, by the way, PG said he's coming in to see you on Tuesday, so
I'm ready.
Get ready for that one.
I don't know if you have an appliance large enough for that mouth.
That may be a dual therapy deal.
You may have to get an old tire rig or something to fit in that chompers.